safer sex,
intercourse, condom,
sexually transmitted infections, HIV,
STI
HIV, sexual health,
races,
treatment,
condoms,
sexual attraction,
sexually transmitted infections,
contraceptives,
sexual health
specialist.
Hello and welcome to the podcast. My name's Tom and this is the Sydney Sexual Health Centre podcast where we talk about all things related to sexual health. Health is an area where there are many intersecting factors that can prevent people from accessing the care that they need. This is particularly true in sexual health. Acknowledging and responding to different needs in service access can sometimes be referred to as applying an equity lens. But what does this look like in practice? To discuss how this is done on a district level, I am joined by the South East Sydney Local Health District Equity Manager, Evan Freeman.
If we don't use an equity lens, the people who are most disadvantaged will be continually left behind.
I am then joined by Maggie Ma, one of the Sydney Sexual Health Centre Health Promotion Officers, who works with our Chinese-speaking consumers.
They have a HIV or a STI, they may have to face on those things and make them very stressful. They prefer don't know about that. Yeah.
But first up is Evan.
Equity itself is grounded in the social determinants of health and social justice. So we bring that into healthcare and in particularly sexual health. We are trying to make sure that the care we provide and give access to people actually are able to actually get that care that they need when they need it and how they need it to make sure that it fits their lifestyle needs, the things that will make sure that healthcare is going to be successful for them and their outcomes are going to be as good as anyone else.
Evan has a diverse role, ensuring that equity considerations are included in policy and planning processes.
Well, before this role, was a few years ago now, I was working in Aboriginal health in the prison system. So that actually really opened my eyes around equity in particular and the outcomes for people, Aboriginal people in particular in prison and their pathways into prison. And so this was almost a natural fit for me to go straight into something with equity where there's the determinants of health, the determinants of incarceration, all those sorts of things that influence the outcomes of people in their life.
Social determinants of health are non-medical factors that influence health outcomes. They may include things like income and employment, access to affordable, healthy food, or the impacts of insecure housing, to name a few.
Absolutely. The social determinants of health are very important. We don't, I suppose, a lot of places don't take much notice of the social determinants, but they're the key factors that influence people's choices. They're how they can access healthcare. So from housing, access to transport, even as things like people's education and attainment of education, what that means to them and their ability to then take on board health messaging. So these are really fundamental things that if people don't have some of these sort of building blocks in their life, these really impact potential outcomes, whether that be smoking, increase in smoking rates, then therefore they have the outcomes of increased cancer rates, people, the way they may use drugs or alcohol, how people have relationships even are all determined by these social determinants of health. So you can be very specific in some of these things, but they also can be very general, pervasive throughout someone's life.
Here in the South East Sydney Local Health District, we have a wide diversity of consumers that access health services. The ways that health concerns can impact different populations of people differently really struck home for me last year when I was doing some COVID contact management. On one call, I'd be speaking to someone with multiple bedrooms and bathrooms in their house in Vaucluse who had no trouble isolating from others in their household. The next call, I'd be speaking to people not so well off. I remember calling one young person in particular, an international student from Pakistan. He was living in the lounge room of a 2-bedroom unit in Kensington with a curtain separating him from his housemates. He was worried that he couldn't work because he had COVID and wouldn't be able to afford rent or food. When I asked him for the names of his flatmates so I could let them know they were close contacts, he told me that though he lived with them, he didn't know their names. Fortunately, we were able to get him into some hotel accommodation. Clearly, some groups of people need more support than others.
Yeah, South East Sydney is an interesting area. It has great wealth in a lot of areas, but there's a lot of sort of parts of the population and communities, subsections of communities who are quite sort of disadvantaged. So these groups in our area we try to focus some of our work on, which is important because often they need more health care and support to attain their health care than people who are more well off or have more advantage.
The World Health Organization defines health inequities as being differences in health status arising from social conditions. It views these differences as not being something we should accept, but rather as something that is unfair. Importantly, there are things that we can do about it.
Absolutely. So enablers themselves are us as human beings. We need to take responsibility and ownership of making our health services accessible. We need to be the ones who are actually identifying the groups and making sure that we're communicating with those groups to ensure that they have access as they need it. So that may well be that it's the time of appointments, where appointments are, having flexibility and the knowledge to attend, making sure there's follow-up phone calls. That's our systemic response, and that's a real important part of what we need to do to improve equity outcomes. The barriers, of course, are us as well. They are us and they are our systems. So it sort of is that bounce between the two. And also society that reinforces the barriers, particularly around sexual health, a lot of guilt, a lot of shame, a lot of issues that people don't necessarily want to go to see sexual health services or even speak to their local GP, because there's a lot of fear and shame around, people and the fear of being labelled around sexual behaviours, and so those things we have to try and work on as well as a barrier. That means educating our other health professionals and services to try and be as non-discriminatory as possible and be positive as possible around those issues.
Communities often have a lot of strengths that can help solve these problems. Evan helps ensure that community voices are involved in planning processes.
So it's identifying strategically plans and how projects are actually developed. So identifying community engagement processes to make sure that they are probably done in a way that is really inclusive. It's not just a consultation, it's true consultation. So you're getting a feedback loop, and using co-design types of process. So really trying to get people to do that better, because often what we see is that people do a consultation, they'll ask the same people or the same person for their opinion, and they believe that's consultation. So part of my job is to actually raise the awareness of staff for how they do it, and you actually say, well, how has your consultation actually occurred? Because you should be doing it this way. And supporting them to do it, because you're changing behaviour in the way people normally do things, so you have to actually support people. So that's mainly my role. Is it whether it's, again, plans, that's a big one too, so strategic plans, making sure there's equity included in it, and that's then followed through in the monitoring of those plans to make sure they follow up with those things.
The South East Sydney Local Health District Equity Strategy is an important document that helps to guide these processes through the various facilities in the district.
Well, the strategy is about improving equity across, basically, and the outcomes of equity outcomes across the district, and it's a broad strategy that tries to touch on every area, if possible, particularly those areas of most disadvantage, or those areas of the highlighted the most of concern, whether it be through homelessness, whether it be through language, gender, and making sure that the groups who are most affected are actually targeted for appropriate services, and that the biggest challenge, I suppose, for the equity strategy is making sure it's something that people understand and can use, and it's actually something that people in executive really take on board. I mean, it's part of strategy, and it's mentioned in our strategic directions for the organisation, so which is good. But yeah, it's something that is ongoing, and it has a very long life, the equity strategy, because it's designed to have effects over a generation. So it's not going away as a strategy, but it's something that
change overnight.
because exactly, which is appropriate, because you can't change equity normally with the stroke of a pen. So even if you throw lots of money at equity, it doesn't change straight away.
And of course, COVID has had a major impact on the healthcare system. Not only has COVID made people with more health conditions less likely to access healthcare due to concerns over their risk, it also means that there have been reduced services as the health system adapted to providing vaccinations and testing.
I think that we'll see lots of things, unintended or unthought of consequences of COVID come through, and we need to be putting that equity lens over how we do things. If we don't use an equity lens, the people who are most disadvantaged will be continually left behind, and we're the ones harder to catch up with their healthcare, and therefore have those equity-related outcomes that are further puts them back. So absolutely important.
Evan had these final thoughts to share.
I just would like people to really take on board equity and internalise it. We as healthcare providers have the duty to do that. We live in a very advantaged society, and we shouldn't be leaving people behind who really don't need to be. And it is incumbent upon us to think outside ourselves as clinicians in particular. It's not about us. And so we need to make sure it's easier and accessible, our healthcare, no matter where it is.
My next guest is Maggie Ma. Maggie works as a multicultural health education officer supporting Chinese-speaking consumers to access sexual health services here at Sydney Sexual Health Centre. So welcome to the podcast, Maggie.
Thank you, Tom. Thank you for inviting me here.
Can you tell me about yourself and your role at Sydney Sexual Health Centre?
I'm the health education officer here. My role is to provide sexual health education for the patient who speaks multilingual. I'm doing outreach and assist with the attend fiber scan clinic and contact tracing, follow up with the healthcare, assist with the clinic, and then also assist with the healthcare worker, example, doctors, nurse, and the receptions, and helping patient to access Sydney Sexual Health Centre.
And what sort of things makes it difficult for people you work with to access healthcare?
I think it's the language barrier and no Medicare card, a fear to test and then diagnose with STI and HIV.
Right, great. And many of the consumers you work with may have been born overseas and not have English as their primary language. What are some things that make it easier for them to access healthcare and know where to go?
Sexual health offering a direct line that speaks the same language, and the health education officer, we can use WeChat, text message in language, clinical flies with maps in their language, and then we're having nurse speaking their language as well, and this can help them to get direct and access to the clinic.
Do they make an appointment, or do sometimes they just show up? Or?
In the past, those we offer walk-in clinic. They can come in with group, they can come in alone, and right now, since the COVID pandemic, we just started a booking appointment, which is offering quite occupational health safety issues, and also it's quite safe with our client and make them feel more comfortable with. Yeah.
It works with their schedule.
Well,
I guess,
yeah,
more
yeah.
flexible.
That's right. Yeah. They feel quite comfortable and happy with the environment we provide in here. Yeah.
Could you tell me a little bit about the sex worker population that you work with as well, and what makes it difficult for them to access a service like Sydney Sexual Health Centre?
To be honest, it's not really enough knowledge with the sexual health, and without knowing lots of information, they provide and protect sex and oral sex. Some of they think is that this is part of a service they need to provide, but with those affair to the diagnosis of STI or HIV. So this is the barrier. They doesn't want to come here for check. Instead of, they are clearly find out if they have a HIV or a STI. They may have to face on those things and make them very stressful. They prefer don't know about that. Yeah.
And that's a big part of your role, I guess, having those relationships and helping to make people feel more comfortable having those conversations.
Yeah. So we have to provide a friendly, no judgmental service in here, and make them feel much comfortable, and to helping them to step by step to build the relationship, and they set up the trust with us, and then they get regular checkup. Yeah.
And do you have a lot of people that you've been seeing for a long time who you have that relationship with?
Wow, yeah. I recently received a phone call from this girl since 2019. Haven't been in contact with me. And she suddenly gave me a call. I recognized her voice. I said, "Where are you? I haven't seen you for 2 years, almost 3 years." And she said that she been overseas for a little while, and then she just come back. These girls having multi issues, and she also been with counselor service as well. Yeah, and but she's a quite nice girl and very open with us. And I have a book her for this morning. Yeah, and she will pop in soon. Yeah.
And I suppose, if people are travelling or just visiting Australia, they might not be very familiar with how the Australian healthcare system works.
That's right. Yeah, some people never heard about us when I meet them, and they was surprised that Australia provide a free and confidential service, and they often ask me why you provide free one. So there's question mark in there. And I have to explain to them again and again. But sometimes it make me easier because there's a co-worker working with them. They knew me. And then they said, "Oh, I can explain to you later on." So it's make my work is a lot easier by word of mouth. And I also link a good relationship with the parlor owners. Yeah, and some of the owners we still connected with. Still, even during the pandemic, and we still link with some owners. If they have anything they want to, and we try to support them. And sometimes they refer some of workers to me as well. Yeah.
Great. And can you tell me a little bit about the outreach work that you do to parlours?
Outreach work, Yeah, so usually we will visit a parlor and get contact with the parlor owner and link with the reception and start giving the education of the sex worker and how do they prevent STI and HIV. And also, basically, we provide clone control, some of the information for contraception information. Also, inform them have hepatitis B vaccine. Vaccine we provide for free as well, and inform them to having maintain with the CST screening. Yeah. And we also offer them referrals, which is if they have any problem, we can refer to other services, example, family planning or SWAP or Scarlet, or other sexual health center.
So you're really that link with the health system.
Yeah, that's right. Yeah. We are also, during the pandemic, we also provide some financial help with other services as well, because some sex workers stuck with no income and no support with families. Some of the refugee here, or they are really struggling. How do they live? And we refer some of organization. They have some money, income, and also they have a free food to provide with them, and post the food to deliver the food for them as well. Yeah. So the workers are quite really happy with that. Yeah.
Thank you very much for being on the podcast today, Maggie.
Thank you, Tom. Thank you. This is a very good opportunity to share my experience, and thank you for everyone. Look after your health. Thank you.
Thank you for joining us for the latest episode of the Sydney Sexual Health Centre podcast, where we've been discussing equity. To stay up to date with the latest information in sexual health, you can follow us on Twitter, Facebook, and LinkedIn. The links are in the description. If you like the podcast, please share and subscribe.